pressure time scalar, inspiratory hold breath, peak pressure, relative pressure. With the pressure time scalar, and how to identify. In the compliance again, we should know static compliance, dynamic compliance, total compliance, specific compliance, and point of maximum compliance. Point of maximum compliance. Point of maximum compliance is found in pressure volume loop. But in this pressure time scale, we can calculate static compliance, dynamic compliance, and total compliance. Volume by volume change in volume per unit pressure change. Change in volume and tidal volume. Change in pressure for static compliance, CS P plateau minus P. So we can get static compliance with dynamic compliance. Tidal volume by P minus P. Then total compliance. What is driving pressure? Most important parameter now is driving pressure. More than static compliance and dynamic compliance, most important parameter to know the severity of the ARDS is driving pressure and the mechanical power. So how to get driving pressure? Plateau pressure minus P. We should maintain it less than 15. So this is regarding compliance. Every calculation we can get at bedside by looking at scalars and loops. They are like windows to look into the mechanism of the patient respiratory system. They are like windows. 3 front windows and 2 side windows. 3 scalars and 2 loops. We should continuously look into through these windows, and we should assess the mechanics, the compliance and resistance of the patient. This is for compliance. For elastance, elastance is reciprocal of compliance, 1/C. For that, we should know total elastance and elastance of the respiratory system, elastance of the alveolar tissue, elastance of the chest wall, and specific elastance. For resistance, we should know maximum resistance, minimum resistance. There are various formulas, calculations for everything we can get at bedside by looking at monitor. Patient, ventilator graphics, and monitors, they are ready to tell stories. Only thing is, we should listen to him. We should be a good listener. Scalars give a lot of information. Okay. Then compliance, elastance, resistance, then conductance. Conductance is reciprocal of resistance. You can get calculations of impedance, inertance, and reactance of the respiratory system. And you mentioned about work of breathing. Do you know work of breathing formula? Formula for work of breathing, pressure into volume. Not only work of breathing, most important parameter now is mechanical power. Mechanical power of the patient. We should know pressure generated by the ventilator. That depends on resistive load and elastic load of the patient. Their mechanical power, again 2 calculations. Gattinoni calculation, Becher calculation for mechanical power. There is one parameter, pressure time product, PTP. Pressure time product we can get by multiplying inspiratory time with PIP, peak inspiratory pressure. So work of breathing, mechanical power, pressure time product, and oxygen extraction, VO2 of the respiratory system. For that we should know FiO2 and FeO2. And inspiratory, maximum inspiratory pressure, NIF, negative inspiratory force. Maximum inspiratory pressure, maximum expiratory pressure. On bedside, we should do all these calculations. Asynchronous, most important is asynchronous. We have to identify asynchronous. There is AI called asynchrony index. Every hour we should note down number of asynchronous. Asynchronous, they are mainly classified according to the phases of breath. One trigger asynchronies, flow asynchronies, and cycle asynchronies. In the trigger asynchronies, there can be delayed trigger or ineffective trigger, auto triggering, double triggering, reverse triggering. The flow asynchronies, there can be inadequate flow or flow excess. In cycle asynchronies, there can be premature cycling or delayed cycling. This is according to phases of breath. There are other classifications. The FAM classification divides into over-resistance and under-resistance. And there is another classification, Longinus classification, divides into major asynchronies and minor asynchronies. So next class will be on asynchronies.